experts knew that wasn't true, and now it's proving not to be true. This lies squarely on you. Hey, it's Dr. Rob Davidson here in Michigan. I'm on the way into my shift in the emergency department, and just had to take a minute for a brief message for our president. Heard that you were on Hannity tonight attacking my governor here in Michigan, my governor who has issued a shelter in place, who from the beginning has taken this entire crisis seriously, who's working overtime with her office and with hospital systems in the state to get us ventilators, to get us masks, to get us the gear that we need, to help get us tests here in Michigan. Here and everywhere else in this country, we still don't have enough tests. I'm still using one single paper mask for an entire shift because of shortages of PPE. We have hospital systems here in the Detroit area in Michigan who are getting to the end of their supply of ventilators, and they're going to have to start telling families that they can't save their loved ones because they don't have enough equipment. And I hear now that the president canceled an order for $1 billion for ventilators from GM because they were worried about having too many. President Trump, for you to blame anybody but yourself is expected, it's predictable, but it's just sad. We're out here on the front lines trying to take care of our patients, working hard with our governors in the states, and all you can worry about is when you're going to get people back to work and back to church and trying to make yourself look good in all this instead of taking the leadership role that you've needed to take for so long. I still have people in this state who don't believe that this is a big deal because you told them it was a Democratic hoax, because you told them it was just like the flu or like a cold or looked just like that it would be gone, when none of that was true, when your experts knew that wasn't true, and now it's proving not to be true. This lies squarely on you. You still need to issue a national shelter in place. We still need more tests. We still need the Defense Protection Act to be fully operationalized so we can get ventilators and PPE. That is on you. Please help us on the front lines, President Trump. That's all we're asking. We need help from our national leadership.
Nice to meet you, Mr. Vice
I'm an
President.
emergency doctor. I'm worried about the plans they talked about last week of maybe cutting Medicare and then the rollout today of cutting Medicaid. I work in one of the poorest counties in Michigan, and my patients depend on expanded Medicaid. So how is that going to affect my patients?
I haven't heard about cutting some Medicaid.
Cut Medicaid, yeah. The head of CMS announced the plan to let states file for waivers so they could get block grants. So that would essentially cut the amount of money going to the states. So it would cut federal Medicaid funding. Is that a good idea?
Actually, when I was governor of Indiana, we got a waiver from the Obama administration that actually allowed us to expand Medicaid coverage in the states.
Right, but now they're talking about scaling back the Medicaid expansion that we got with the Affordable Care Act, and that 680,000 Michiganers, 600,000 in Iowa. A lot of people got health care.
We expanded coverage in Indiana.
Right, but I'm just talking about the president and your administration right now, what they're doing. Right now, they're cutting Medicaid.
Those are waivers for states that didn't take expansion.
No, it's for people who took expansion money too. I mean, your administration just announced this, they rolled it out today, and it's going to affect millions of people across the country cutting Medicaid. I mean, is that a good idea or is that a bad idea?
I think you're oversimplifying it.
Well, I think it comes down to that for the people I take care of all the time. I mean, people I see in the emergency department that can't get primary care doctors, once they got Medicaid, they could get primary care doctors. They stay out of the ER. They actually work more. They actually contributed to our community more. Now, if a couple of people, sorry, you don't get your health care, I mean, that's going to be a real negative in their lives.